Hi everyone, I'm Dr. Swati Agarwal, dermatologist from Skin Nation Clinics, Delhi. So today I'm here to discuss various frequently asked questions on wrinkle reduction, that is Botox and Dysport treatment. First question when they go for wrinkle reduction treatment is that, doctor, will it be safe or not? So yes, Botox, that is wrinkle reduction treatment, when done well is absolutely safe. So what do we mean by when done well? There are three things you need to know. Right patient selection, that is you should be the right candidate to get done your Botox treatment. Second, your doctor selection should be right, that is you have to get it done with a trained dermatologist who has taken training in this and do this procedure frequently. And third is product selection. So when I use Botox and Dysport. These are two internationally renowned brands for wrinkle reduction. Second question is, so we have to know that Botox or Dysport, the frequently done wrinkle reduction treatment, will stay for 4 to 6 months. That is, it starts to wane off at 4 months and it is waned off at 6 months. So I would say no, because it is the longest lasting non-surgical treatment for wrinkle reduction. We have to understand we are not going under the knife. This is a non-surgical treatment that takes few minutes. For example, the entire upper face takes less than 30 minutes. And then because it's the non-surgical treatment, 4 to 6 months is a pretty good time. Another question asked by patients is, so no, they are absolutely different. One side Botox is for wrinkle reduction, on the other side fillers is for facelift, for contouring, for shaping, for example filling up your lips, lifting your cheeks, correcting your nasolabial folds, correcting your jawline or the shape of your chin, or filling up your temples, so giving you an anti-aged look by lifting. So on one hand, when Botox is doing wrinkle reduction, this is doing non-surgical facelift. So both the treatments are absolutely different. Sometimes we confuse because both are done together. So in your 20s, in your 30s is the right time to start your Botox or wrinkle reduction treatment. This also depends on what change are you looking forward to in your face. So for example, if there are wrinkles that have started to bother you at an early age, it is the right time to do your wrinkle reduction. But yes, with the advent of medical technology over the years, it is seen that if you start at a very late age, for example at 50s or in 60s, then the ultimate outcome may not be that great as compared to when you get done in your 20s and in your 30s. Main reason for that is that when the age has advanced, the lines become static, that is even when you are not moving, there are wrinkles and there are furrows which do not go completely with Botox done at such a late age. So 20s or 30s is the right time to enjoy better outcomes and sustained outcomes. So Botox is one versatile molecule which is used for over 100 indications globally. It is used for medical indications like urinary incontinence, on the other hand used for severe headaches like migraine. Aesthetic indications are different. The most commonly done indications are forehead lines, that is when you raise your brows you have lines on your forehead. The other indication is 11 between the brows. So when you frown, there are lines between your eyebrows, for which Botox is frequently done. Third is crow's feet. What is that? Is when you smile, there are lines at the angle of your eyes, for which Botox is frequently done. Other indications are slimming down your lower face, for which masseter is injected to give you a more chiseled lower face. Also sharpening of your jawline, popley chin, that is dimpling of the chin, elongation of your chin, are other indications. Also, Botox can be used as meso-Botox, that is more diluted form of Botox on entire face, especially done on the cheek area to reduce your open pores, to reduce your fine lines. Also done in patients who want to have reduced sweating on their face. It is also commonly done for hyperhidrosis, where it is used on the underarm area to reduce sweating, and people use it to prevent social embarrassment. For example, staining of the shirts and clothes happen when they sweat a lot. So a very famous and frequently done treatment in summers. You get it done at the start of the summer and you are sorted for the entire 6 months of summer, especially in North India. Some people ask, so no, it's not that everybody will look mask-like. It is about doing the right appropriate doses of Botox. If you overdo, if you overcorrect, sometimes you look too artificial, which most of the patients do not want. So how to prevent that? I tell all my patients it is important to do the right appropriate dosing. Not less, not more. With less, you might feel that the result was not up to the mark. With more, you might start to feel that you look very artificial. So right appropriate dosing for Botox for each area, whichever area you are treating, is utmost important for natural and pleasing outcomes. So how do we get to know the appropriate right dosing of Botox? For this, it is very, very important to have a detailed discussion with your treating dermatologist, in which we discuss and decide on what is it that is bothering you on your face. For example, if it is the forehead lines, what exactly is the change that you want to see? Similarly, for frown lines, for crow's feet, for masseter, that is boxy lower face, the right appropriate doses are decided by examination, by the change you want to see. You want to have a more natural look, or do you want the complete outcome, which can require a little more doses. So thus, if you do that, you are sure to get the natural outcome. So these were some of the frequently asked questions by my patients about Botox, the famous wrinkle reduction treatment. If you have any other question, please feel free to ask in the comment section below. We'll be really happy to answer those questions. Also wait for my next video, which talks about another very famous anti-aging treatment, that is fillers. Thank you so much.